Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Harvey Castro. He's an emergency physician, healthcare consultant, and entrepreneur. We're going to talk about the Apple Vision Pro and how it reboots medical diagnosis. Harvey, welcome back to the show.
Hey, thanks for having me.
So Harvey's been on multiple times. Go to kevinmd.com/podcast to search his name and hear his story in prior episodes. But today, let's jump right into a recent one about the Apple Vision Pro and how it reboots medical diagnosis. For those who didn't get a chance to read your article, tell us what this one's about.
Honestly, at the end of the day, it's pretty simple. We have this new tool called the Apple Vision Pro, and I see this as really helping us in healthcare. And the article just basically goes through different scenarios and love to share those kind of different ways we can use this Apple Vision Pro in healthcare.
Yeah. So for those who aren't familiar with it or didn't see the keynote or haven't gone to an Apple store to demo it, just give us a brief description about what it's about and what makes this different from a technology standpoint.
What makes this device differently from all the other ones that are out there, like Meta glasses, is the ability to see through this device. Usually, when you put on these devices, you really can't see well through it. And so, for example, there's neurosurgeries being done right now with the Apple Vision Pro because you can see that clearly through it.
So why is that important? So the fact that you can see clearly through it, and I know we have a lot of these, augmented
Yeah,
reality, VR type glasses. So why is that important?
yeah. Because the image is so clear and you can literally walk through an OR and do a procedure with the device on, and there's really no lag time. And I say really, there's nanoseconds, but our brain really doesn't see that lag. And so why it's so important, imagine I'm doing surgery on a patient, but I need to pull up their x-ray or their CAT scan report and
Yeah.
being able to visualize it while staying sterile and in the operation field. The other part, imagine I'm about to do surgery and let's pretend I'm doing surgery on you, my friend, and I create a digital twin on you. Now I can do the procedure on your digital twin using the Apple Vision Pro. And so it makes training so much better.
All right. So I think Apple Vision Pro came out within the last few months. So tell us about some of the healthcare applications of the device.
As far as healthcare, I had a lot of fun taking a look at Epic. I know a lot of people aren't crazy about Epic, but I was really impressed with their product. What they did is imagine putting the Apple Vision Pro, and as an ER doctor, I need information right away. So if a lab result comes up, I want to know immediately. And so imagine having this on and having the Epic application on where I can start seeing the labs as they're coming in.
Yeah.
And say I need to see your X-ray, for example, then I can literally pull up the x-ray as I'm having these on. But the nice part is with the Apple Vision Pro, I can blow it up and it could be a 100-inch screen bigger than my PAX machine. And then to make it great for our patients, I can mirror this to the TV that's in the room with the patient. And now they can see that x-ray of the lab or what I'm talking about.
So for those who haven't tried it, gone to Apple Store, made an appointment to try it, what's it like wearing it, and what exactly are you seeing? So when you say that you can see through the device and it's more defined than you could in real life, just give a description. What exactly are you seeing?
Yeah. So right off the bat, say I'm in my office right now and say I had them on, I could be able to see you directly with the vision. And then say I needed to pull up an x-ray, I can literally put it up here in the virtual world and I would be literally seeing it. And it's so clear that sometimes I have it on for several hours. I'll forget that I have it on. And I know that sounds silly.
Hmm.
But for example, say you were giving a presentation and I'm looking at your slides, sometimes I'll take a picture of the screen and one time I caught myself taking a picture of the virtual world thinking it was a slide, and I wanted to take a picture of the slide.
Yeah.
And that's how real this thing is.
All right. So you talk about innovations in surgery, medical records. What are some of the other case studies or examples?
Yeah, I'm going blank on the name of a company, but I've seen two different applications in the mental care space. And it's basically a combination of VR, virtual reality, say the Apple Vision Pro, plus artificial intelligence. And in that artificial intelligence, what the user can do, this one is mental issues in the sense that if they're having depression and they're able to have a conversation with this virtual bot, they'll see it. They can put calming music, they can white everything out. So now, like I mentioned, that see-through,
Hmm.
you can create an environment where, say, your favorite warm place is the ocean or whatever that is, and they creates that environment. So you're literally immersed in this environment, and now you're having a conversation with this bot to go over your symptoms, and it's recording. And then all that information obviously goes to your healthcare professional that can go through and say, okay, yeah, this is where they're at on their therapy. Think of therapies like PTSD.
Hmm.
And so they're able to go through different scenarios. And I'm really excited. The other one that's really kind of small, but I thought that was interesting. They use Kung Fu Panda
Hmm.
avatar, and it's to help you relax and meditate. And I thought, you know what, these are great tools for our patients. Some individuals may need this more than others. And I thought, man, this is a simple app that they can go through and immerse themselves in this environment.
One of the things that you touched upon about how the Apple Vision Pro can improve early diagnoses of conditions. So, what are some examples of that?
Yeah, so having this now, this is a little bit of futuristic, and obviously some things need to be FDA approved. But imagine the ability to pair this VR with AR
Mm,
and being able to have experts like yourself and say, well, you and I were consulting a patient, and then now I have you with the VR, I'm in with the VR, and we're seeing a patient, and now
mm.
I can take advantage of your expertise. And you'd be like, Harvey, this is actually this disease. Have you considered it? Imagine doing ground rounds with this thing on. Imagine not limiting ourselves to just say California and Texas, but now we can take the world's experts and bring them into VR and help us diagnose patients. So it's a combination of using AI, VR, being able to have this pass through effect that now literally we could be walking through the hospital and seeing our patients, and then leveraging technology, leveraging AI, and obviously the human in the loop, someone like you, an expert that I can say, hey, what do you think of XYZ?
Now, you mentioned some real life scenarios that's happening now. Epic, you said, has application for it. Surgeons are really using this as we speak. This is not something that's going to happen in the next few years, but this is actually happening right now.
Yeah, what's crazy is literally on day one, a neurosurgeon started using this device on day one to do neurosurgery, which I was shocked that they were doing something as delicate as neurosurgery. Last month, I read an article on Fox News that basically talked about a augmented reality abdominal surgery done not with the Apple Vision Pro, but they actually use the Meta glasses, which don't have as good resolution. And so doctors are using it. And then anecdotally, I've noticed on LinkedIn doctors putting surgeries that they have done using the Apple Vision Pro online and just showing how they're using it. One quick example, wound care. Say you had a patient and you had to classify that wound. Imagine being able to use both. We're using the augmented reality that has a 3D camera on it, being able to take a picture of the wound, analyze it with AI, and then tell you how that's progressing, and then being able to share that with others. I mean, that's live application. Someone's in surgery able to do that right now. We all know that sometimes our surgeons are, depending on what they're doing, they're using separate glasses. Imagine being able to blow up the surgical field or the lesion that's so small, making it this big that now the resolution is really clear and they can jump in and act on that particular lesion.
Now, for those who aren't familiar with these terms, just give us a brief contrast between AR, augmented reality, and VR, virtual reality.
Yeah, so that's an excellent question. So think of virtual reality that I literally, this is my office, but now I want to make this, I'm in the middle of the beach. So I can convert this office into the middle of the beach. But say I'm in the medical field and I want to do virtual, augmented reality where I'm having a conversation with you and say I need to pull up your x-ray. I can pull up this virtual world of augmented reality and show your x-ray. And then since I have the device on, I can mirror it on the TV so that you can see it. Or ideally, if you had a device and I had a device, and then together we're able to see it. I think medical education is going to be huge. Imagine the pathophysiology trying to teach a patient XYZ, having them put on the glasses and say, hey, let's walk through your heart. Let's walk through your x-ray together. And for them to understand what's going on with their pathology. And that way they know, you know what, I do need to take my medicine.
Now, do you see sometimes the risk of wearing these glasses as just another technological barrier that separates the physician and the patient? You mentioned a scenario in the emergency department. If you came in wearing these glasses to a patient, do you see that acting as a barrier that may impede the relationship you have with that patient?
For sure. It's unfortunate and fortunate. It's patients don't know, especially people have never heard of the Apple Vision Pro. Sometimes I'll wear it on an airplane. People look at me like I'm crazy. So it is a factor. It is a barrier. So obviously for HIPAA reasons and ethical reasons, we should ask permission from our patients to see if they agree or don't, and then spend the time with them so that they understand what we're doing. And I really think it's important to mirror what we're seeing on that screen. So that way the patient can be like, okay, I see exactly what he's seeing. and get them involved and see how this is actually beneficial for their health. But if they don't see it that way, then obviously I would respect their patient's wishes and not use it.
Now, is that common practice, like patients seeing or the audience seeing what you're seeing and having what you're seeing mirrored on a screen? Is that common practice?
This is such a new technology. I wore this thing on hymns on stage, and people were happy to be able to see what I was seeing, to be able to be transparent. The big thing right now with AI is transparency. And so the more transparent we can be with our data, with what we're doing, the better for our patients. So I believe this is a common practice or will be.
Now let's talk about the technology itself. So, are we there yet with all the scenarios and case studies that you mentioned? Is the technology there yet with Apple Vision Pro, or does it still need to have different iterations and future versions?
I think we're to some degree there. This thing weighs, I think, 2 pounds. I really believe that the future is near, and I've seen some studies that are close. These are meta glasses, and basically, I can have a conversation with you and use AI. But what I'm getting at is the Apple Vision Pro eventually will just be on the screen of this lens, and so instead of being in this virtual world, I can actually be out, and then I can see everything I'm saying on the actual screen of that lens, which will be amazing. So I think we'll be there in the near future.
So, a couple years ago, or maybe a decade ago, we had Google Glasses, right? And we
Yeah.
had a lot of these case studies and scenarios, kind of similar to what we're talking now. So what makes this different? What makes the Apple Vision Pro different from the Google Glasses, and why is it not just a fad?
Yeah. No, that's a great question. Obviously this thing is really expensive, so it can't be given out to the common consumer because it costs a lot of money. And honestly, in the hospital system, I'm noticing that it's the departments that have more budgets in their budgets. So like the surgery department, neurosurgery departments are carrying this. What makes this different is the chips that we have today are 10 times better or more actually than what Google Glass has. The resolution is there. That lag that I mentioned, it's really not that much of a lag. You can't see it, whereas before you could kind of notice it. So all these technology differences are making it. Plus, culturally, we're so many years out from the Google Glasses. Now we're starting to accept these things into our workflow. We're starting to accept it as a patient, and so I think we're getting there now, as opposed to that was really early on.
Now, you mentioned cost. So, in general, how much do Apple Vision Pro headset cost?
Yeah, it's about 3,500, and that's a lot of money. And obviously, that's just the lowest model, and then it all goes by memory. So the more memory, the more expensive. And then if you buy the warranty, so you could easily hit 5 grand pretty easily if you tried just buying everything that they have.
So, what are some immediate foreseeable steps just in the next, and I know we're talking about technology advancing so quickly. Say in the next, say, 6 months or so, what do you see the adoption? Are you seeing medical institutions and medical schools adopting this? What kind of uptake are you seeing?
Yeah, it's interesting. Healthcare is a little slow on some things, and the culture is stuck on doing certain things a certain way. But I do see education actually being one of the first things that will start seeing. Being able to dissect a human, being able to do it with the Apple Vision Pro, that is huge. Imagine all how many times you and I were in the lab trying to dissect when we were in med school, and that we only could go in certain hours, and if we wanted to go at night, we had to get a pass. Now I can literally put these on and go through the anatomy, and I can learn so much quicker. So I really see medical schools using this for sure for anatomy lab. The famous saying is see one, do one, teach one. This is exactly that. Why not do this 100 times on your Apple Vision Pro before you actually do it on a real patient?
Now, has Apple themselves, have they touted some of the healthcare applications of the Apple Vision Pro through their promotional materials?
I haven't seen anything interesting enough. I've actually seen third-party companies starting to adapt this technology. They've done it for the other VR headsets that are out there and promoting it on the Apple Vision Pro because of that see-through ability that I had mentioned.
So you mentioned that you wore this on HIMSS during one of your talks. So at HIMSS, what kind of companies were utilizing that technology, and what kind of applications do you think are through the pipeline at HIMSS?
I went through the exhibit real quickly. I didn't see any particular company, so but I don't see that many. I've just seen different organizations post that they're using it, the mental care space, a lot of surgery applications for this device. And then I've seen different hospital systems, going blank on the name of it, in California that are actually using this device. And I've seen some ophthalmologists starting to use this device as well. I know this is looking at your eyes. And so instead of using a mouse, every time you turn your eyes around or you look around, that's where where you hit enter. And so I believe with that type of technology, it's able to look at your eyes and be able to diagnose different things. Now, obviously, that would require FDA approval, but I think the technology is there. Now we just need to make sure that FDA approves those types of scenarios.
And when you say the technology is there, it's stable enough for surgery. It's not going to glitch out. It's not going to pause like in the middle of a procedure or something like that.
As far as I have read and seen and spoken to some of these surgeons, they have had zero issues with that. As far as battery life, you are able to connect different batteries to the main battery, so you're able to extend it for 8, 12-hour surgeries.
Any downsides you see to increase uptake and utilization of the Apple Vision Pro in healthcare?
Obviously, for me, it's the cost and the weight. I have read some case studies of individuals saying that they're having neck pain and issues or headaches from wearing this device. I personally haven't had any headaches or neck pain from it, but I think this device should get smaller. Like I mentioned earlier, maybe we should be just glasses. But I think those are, and obviously the cost is another big barrier.
How long can you wear a headset, the Apple Vision Pro, during one sitting?
I mean, honestly, I've worn it as long as 8 hours, and the only reason I stopped is because that was the end of my workday. So I think at the end of the day, it's physiological. Each person will have a different tolerance to it. There is some interesting early case studies that are saying that if you're wearing this too long, you will have trouble driving. There's not that many studies, but I did see one, and so I found that interesting. So if that is the case, maybe there might be a scenario that says, okay, once you wear this, you're not allowed to drive for like an hour, so that your brain readjusts.
So you've worn this during one of your emergency department shifts?
I have not. Right now, I'm doing a lot of consulting, so I've stepped away from actually being in the trenches, but I've been working with different colleagues that are actually using it. The main thing with them when they want to use it is the administration is telling them, "Hey, we're not sure about this technology yet. Do not wear these."
We're talking to Harvey Castro. He's an emergency physician, healthcare consultant, and we're talking about how the Apple Vision Pro reboots medical diagnoses. Harvey, as always, we'll end with some of your take-home messages that you want to leave with the Kevin MD audience.
At the end of the day, it's all about the patient and just be sensitive to what their needs are. And together, let's use our clinical gestalt and technology to give them a better healthcare.
Harvey, once again, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.